their clinical usage. So for hyaluronic acid for filler, it gives you this instant volumizing result, while Sculptra, the result is gradual and with a little volumizing effect. But the difference is the duration for Sculptra lasts much longer, and the indication for hyaluronic acid, I would do at areas with there are only focal volume defects or in areas where you need projections. But for Sculptra, you can do it in a large area. The most important difference is Sculptra is good for treating skin laxity, while hyaluronic acid has very little effect. So aging actually takes place from each layer, from deep to superficial. There's bone structure change, there's volume loss, there's tissue displacement, and there's skin quality change. And actually Sculptra is good for all the aspects, but its unique strength lies at, first of all, the skin quality. Let's take this study published 2019. It's Sculptra inject into the dermis, 3 sessions, follow up to 1 year, and at this 1 year follow-up, they see a significant increase of a lot of parameters like elasticity, hydration radius, by the observed. They have a name created for this phenomenon. It's called Sculptra glow. So these are the before and afters. So just at this glance, you can see the before and after. Their skin looks more radiant and shiny and glow after Sculptra treatment. And also it helps with tissue displacement. That means Sculptra makes your skin firmer. So this is the work of the godmother of Sculptra, Dr. Rebecca Fitzgerald. I admire her so much, and she's been in Taiwan a few times. She's been involved in Sculptra research since the very beginning, and this is one of her injection work. A very nice firming and lifting effect after only 1 vial of Sculptra for a 40-year-old lady. And 2 vials for this 50-year-old lady. It's not really just about volume change, right? It's like make your skin firmer so that you can see a lightening of her nasolabial folds and nerve lines. And of course, if you get older, you need more vials, but you can still see the significant help for the tissue displacement. How about Asian patients? This is the wonderful work of my colleague in Taiwan, Dr. Jason Lee, who came for the launch in August. And after 2 vials of Sculptra, 3 months later, what do you see? She looks just much more refreshed. The skin quality is better, it's firmer, and it's more radiant, right? Another patient, you can see, the point is about the skin quality change. Okay, so who are the ideal patients of Sculptra? To answer this question, I would actually recommend a very useful tool to evaluate and plan your treatment. It's called Galderma Facial Assessment Scale, composed of 4 dimensions: the skin quality, the facial shape and morphology, and expression lines. Okay, and each of the dimensions are divided into 2 parameters. So the difference between facial shape and morphology is that facial shape is more aging related, the volume loss and the saggy, but the morphology is more like inherited or born with. Okay. And so each person is evaluated and given a score. A score might look like this. And this is the kind of patients that is good for Sculptra, because her main issues are the skin quality and the skin laxity thing. Okay, this is the patient you should choose for Sculptra. So mainly for poor skin quality and skin laxity. And actually, Galderma has this full and intact portfolio of products that can tackle each of the 4 dimensions. Like, we can combine Sculptra and Skin Booster for skin quality. We can combine Sculptra and the resident fillers for facial change, for facial shape, and fillers and Dysport for morphology, Dysport and Skin Booster for expression lines. So, say Sculptra and Skin Booster both help skin quality, but what difference do they make? Okay, they address different areas of like skin quality improvement. Sculptra is more for the firmness, and Skin Booster is more for the radiance. So a skin can be dull. Dull means lack of water, not enough water content in the dermis. Okay. Loose means decreased collagen density in the dermis. Okay. So a young person may not have loose skin, but her skin can be dull. And of course, you can be both dull and loose. Now you need more weapons to address those problems. And the combination can also be for different areas, because there are some no-go areas where you cannot inject Sculptra, like the periorbital area. So in order to improve the skin quality there, you can only use Skin Boosters. How about the facial shape? Okay, you can combine Sculptra and filler. So this is a work published last year by a Brazilian doctor, Dr. Luis Avila, and he combined HA and Sculptra. The Sculptra injecting mostly on the lateral parts, the white parts, Sculptra, and HA along the zygomatic ligament. He called this firm and lift technique, and he followed up for 18 months, and after 18 months you can still see the significant clinical improvement. I'm sure if he follows longer, because Sculptra lasts for almost 25 years, 25 months, I'm sure the results will still be improved. So, how about other biostimulatory products? Before entering this session, I want to stress one thing. There is no single biostimulator product that is suitable for all indications or all patients. No. It's our job as aesthetic physicians to know the properties of different products and to use them wisely. And you will see a lot of claims from the company, lots of comparison tables on internet maybe, like we. And a lot of the claims don't really have evidence to back them up. So you need to know which claims are legit, which ones are not. Okay. So in order to better understand this spectrum, we have to understand the factors that affect the collagen amount stimulated. Among these factors, I'm going to talk about only the product factor today. And there are these aspects that can affect the collagen amount stimulated. So the profile of Sculptra would look like this. So a design like this, you can tell that Sculptra is designed to be a strong collagen stimulator. How so? Because, well, first of all, it's irregular shape. A lot of other products are spherical shape. The irregular shape just stimulates more collagen than spherical ones. And the size of the particle, 40 to 60, it is small enough to pass the needles, but it's large enough to not be phagocytosed by macrophages or lost through the capillaries. If it's less than 20, macrophages just engulf them after injected, okay? So I have experience using other PLA products, like when I am in China, and some of them are really small particle, like between 5 to 10 micrometers. So the clinical effect is very transient and maybe to a much less extent. And these are the products currently available in Thai with more or less collagen stimulating efficacy. Okay. A lot of them are from Korea. Some mixed with HA, some actually more HA than a biostimulator. And some have more publications online, some of them not really. So I'll try my best to give you a ballpark picture or a comparison of these materials, but I'm not going to refer them by the product name. I'm going to compare them by the active ingredients. So it's actually better for us to have this basic insights of the differences between materials so that a new product comes into the market, you can maybe know what it could be good or bad at if you have this basic knowledge about the material itself. So, okay, so we're going to talk about these materials. The two are on the left, they are polylactides. And the polymers all fall in the same category as polyester, with only the exception of calcium hydroxyapatite, it's ceramic. Okay, starting from PDLA, there are two forms of lactic acids, the L form and the D form. And so there are three forms of dimers formed, the LL form, the DL form, and the DD form. And hence, three forms of polymers. Okay. Now, PDLA is not commercially used, so it's off the discussion table. The problem with PDLA is that it randomly picks up a dimer to form a polymer. It can be like DL, DL, LD, DL, LD, 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 DL. It's like, it's not in a tight, it's not a orderly sequence. So it doesn't form crystal, that's what I'm saying, okay? PLA, because the structure is ordered, so it can form crystal. You can tell from the appearance of it. PLA looks just more solid, hard crystal, while PDLA is softer, more a little gel-like and amorphous. And that also manifests as their physical properties. PDLA has much lower glass transition point, while PLA has a higher melting point. And the degradation time of PLA is just much longer than PDLA. And there is this study comparing these three different polylactides. And the good thing about the study is that they make the three polylactides into the same size and shape microspheres and inject them into the dorsal surface of mouse. Okay. But first, by the appearance, 30 days after, you can see a faster degradation of PDLA than PLLA. And then, okay, this is the degradation, PLA faster. Okay. And after injecting into the dorsal surface of mouse, measuring the collagen, you can see PLA increase more type 3 and type 1 collagen than PDLA. Okay. Now, because they only follow up to day 30 and the trend starts to show, I'm sure if they follow up for longer, the difference will be bigger. And the only long-term follow-up for PDLA is this study follows up for 24 months on nasolabial fold. What they saw is that the improvement was still there at 6 months follow-up, but gone at 24 months follow-up. Okay, so it just doesn't last as long. And another proof that PDLA is probably more effective than a biostimulator is that they can inject subdermally around the periorbital area. This is a no-go area for Sculptra. So why can they do that? Because, well, like I said, it's more filler in the biostimulator. So that's their before and after. So Jason did a half phase comparison. One side Sculptra, the other side Estafil, and follow up for 12 months. And what he found is that the Sculptra side has longer efficacy and in terms of skin quality improvement and even the volume change. Okay, so if this, let's use this equation, the stimulation intensity times duration equals the total collagen amount produced, then the picture for PLA and PDLA would look like this. Suppose the intensity and duration of PDLA is less than PLA, hence less total collagen. Okay. PDO came to the market mostly as threads before. It's very new as a filler, right? So most of the literature you can find is threads in tissue. But this review of different threads concludes that PDO has the shortest duration. Okay, PLA in middle and PCL is longer. Okay, this is one of the few studies I can find of PDO dermal filler. It uses Ultracol, Sculptra, and Elance, and but it's kind of a little weirdly designed. First of all, it doesn't really mention the dilution it used for Sculptra, and it measures the G prime of Sculptra, which is really weird. Okay, here. So it measures the G prime for PDO and PCL, that I can understand, but why measure the G prime of a diluted Sculptra? It's not used, it's not intended to be used as a filler. Okay. And he injected, the author injected these materials on the dorsal surface of the mouse and observed the volume change. And so, again, the volume change of the Sculptra is just not very well, not our concern here. It's the collagen amount. But anyway, that the conclusion is that PDO biodegrades fast. It actually lasts only 3 to 4 months in vivo. It does the biopsy, but all they mentioned was that so PDO stimulates collagen in a very similar way as PLA and PCL. It doesn't really compare the collagen amount of these materials. So from this study, we can pretty much have this picture that PDO, regardless of the stimulation intensity, has very short duration. Okay. How about PCL? I know you guys don't have Elance here, but most of the PCL studies are about Elance in the literature. And the first human histology study was in 2014, 13 months after intradermal injection, significant collagen around the PCL particles. They have this long-term volume follow-up study, so 2 years after injection of Elance, the volume was very well preserved, even some increased up to 150% of the initial volume. Okay, so I'll give it that PCL is a longevity filler. Okay. But how much collagen does it stimulate? So Dr. Jason and I, we did a study on the dorsal surface of a pig. We injected different materials, and also at this study we tried to see, does PRP or exosome increase the collagen amount of PLA, but that's another story. We just focus on the comparison of PLA, PCL, and PDLA. So we measure the mRNA of collagen type 1, 1 month, 3 months, and 6 months. what we found is that from 3 months and 6 months, PLA is significantly stronger than all the other materials, including PDLA or PCL. Okay. So the picture would look like this. So PCL probably has longer duration than PLA, but the intensity is weaker. And finally, to calcium hydroxyapatite. This is also a very well-studied biostimulator because it was FDA approved in 2006, only 2 years after Sculptra was FDA approved. So there are also lots of studies in the literature. If you're interested in reading the studies, I would recommend these 2 review articles just published this year. It includes almost all the studies you need to know about Radiesse. Okay, and but I'm gonna do the summary for you. So the summary would be, okay, their clinical effect would be 90% satisfaction at month 12. And regarding the histology tests, there are 2 studies. One, follow-up to month 7, significant increase of type 1 collagen in elastin. And the second study compared to HA, significant increase of collagen type 1 in elastin compared to HA at month 9. Okay, and there is another rat study comparing PCL, Elanse, and Radiesse, and found that they have similar stimulating efficacy. And also, this is the study when they combine Radiesse with Ulthera. They found significant increase of collagen type 1, 3, and elastin 4 months after true treatment of Radiesse. And this is the claim. This is the study they used to claim the 150% increase of collagen type 1. Okay, and the clinical effect, it lasts up to 15 months, but that's with Ulthera, not Radiesse alone. Okay, and the final claim is that it's non-inflammatory, while Sculptra is inflammatory. Okay, I'm not going to argue against this, actually. I would say, well, there are controversies as to whether you are really non-inflammatory or not. It's just a matter of degree. And what I'm going to say is that inflammation is not always bad, as long as it's under control. And maybe it's the price to pay if you want to stimulate more collagen. That's what I'm going to say. So, yes, maybe you're non-inflammatory, that's why you don't stimulate as much collagen as Sculptra. Another review article published last year concludes that PLA has, in general, longer longevity than calcium hydroxyapatite. So the equation for calcium hydroxyapatite look like this: less intensity, less duration. Okay, this is a really interesting study published last year. It injects 1 vial of Sculptra and 2 syringes of Radiesse, split site and in the same dilution volume, 3 sessions, and biopsy 2 months after, and the clinical endpoint 3 months after. I'm going to tell you the original conclusion of this paper. The original conclusion is that the clinical endpoint makes no significant difference both clinically and histologically. That's what it is saying. And although Radiesse improves faster in the beginning, but Sculptra catches up in the end. And finally, both have inflammation. Okay. This was published in August 2022. Now in March this year, somebody wrote a letter to the editor and used the histology pictures of that original article and do some analysis and claimed that radius produced more type 1 collagen and induces less inflammatory cells. Okay. Now, I have to say that you can argue that the original study didn't do a very thorough evaluation regarding the collagen amount produced or the inflammation cell. But you cannot draw a conclusion based on the very little pictures of the original pictures published in the literature. It just takes a lot more to evaluate as a whole, to compare this. Okay, so that's just what I'm saying. And you have to know about the story of where this comes from. Actually, there are 2 publications. And the thing is, they only follow up for 3 months after clinical, right? And we talked about the longer duration of Sculptra. So what if they follow up longer? Maybe in a year, I think the difference will start to show. So this is a slide from Dr. Jason. He showed this in August. I'm going to use his slide, but just to stress that each of the material when compared to PLA is weaker in terms of the total collagen produced. Okay? Maybe less stimulation intensity or maybe shorter duration. But you cannot compare the other materials. For example, if you want to compare PDLA with calcium hydroxyapatite, that would require lots of other studies. Okay, so don't take the number of stars too seriously. Okay, I'm just saying. So compared to PLA, all these are weaker. Yes, that's true. But between them, that's another story. Okay. So about the reconstitution. Well, this year the Galderma released the new generation of Sculptra. So what's the difference between the new and the old generation is that they go through additional grinding and the seeding process. It's ISO certified and it's patented process to make sure that they get the finest 20 to 25% of particles and with easier distribution, easier suspension. So it's easier for you guys to reconstitute and use than what we had before. But actually, the reconstitution of Sculptra came a long way. There's a long history since 1999, when it was first CE approved in Europe as new fill. The reconstitution was only 3 mil on label. 2004, FDA approved, but still 3 mil. And they changed to 5 mil in 2010. Why? Because there was just too many complications, nodule formation with the original 3 mil reconstitution. There was this review comparing the old reconstitution of 3 mils and the after constitution with more than 5 mils, and see the dramatic decrease of complication rate if you use 5 mil reconstitution. But actually, most of the experts at 2010 recommend 7 to 8 cc reconstitution. So when I was first exposed to Sculptra in 2010, I did with 7 or 8 cc reconstitution already. And Brazil was actually the first country to change the label to 8 mil. Okay, so between the 5 mil and 8 mil reconstitution, there is a study to compare on split space, one side 5 mil, the other side 8 mil. And what they found is that the efficacy of both reconstitution is pretty much the same, but the complication rate for 8 mil is much less. That's why they changed from 5 to 8. So now I'm going to say, you probably have seen this slides, saying that Sculptra has more nodule formation rate than other materials, but look carefully at the year they quote. It's like, what, 1985 to 2005. That's when the Sculptra label was still like 3 to 5 mil. So the complication rate was, of course, a lot more than now. Actually, after the reconstitution was changed to 8 mil, I haven't seen nodules for years. Okay. So finally, US changed its label to 8 mil in 2021. Finally, let's get to the Sculptra treatment protocol. It would be nice to start with 1 to 2 vials per session, and maybe 2 to 3 initial treatment sessions spaced 6 to 8 weeks apart. Of course, there will be a lot of individual differences in the treatment plan, but this is just an average suggestion. So on average, it's like 1 vial of Sculptra per 10 years of the patient's life. Say a patient in her 20s might require like up to 2 vials of Sculptra, and in her 30s maybe 3 vials, but yeah, some people ages faster than others. Okay. The results can last for 25 months, and you typically need to follow up and do the re-injection maybe 1 to 2 years later. But always under treat. Just you can always add more if it's not enough. But I've seen patients who didn't see the results after like 3 sessions of injection, and he just goes for more. So he injected a total of 12 vials within less than half a year, and then 1 year later, he just somehow all the Sculptra together came out, and it becomes really plump. And so don't go too fast. And these are the areas to be avoided, namely the central areas, the forehead, periorbital area, nose, perioral areas, those with hyperdynamic areas, no-go areas for Sculptra. And these are the areas to be injected, more on the lateral than the medial parts, the temple area, zygomatic arch, malar area, submalar area, preauricular area, and jawline area. So the injection would be suggested using cannula 22 or 25, linear retrograde fanning. Now let's go into the clinical details of the injection. So for the temple area, the entry point would be the middle of the upper border of zygomatic arch. And the injection area is below the temporal crest, lateral to the orbital rim, and of course superior to the zygomatic arch and in front of the hairline. The layer of injection is a cutaneous layer. But sometimes, just myself, I tend to also inject between the superficial and deep fascia. And it's actually easier for you to navigate the cannula in between the fascia than at the subcutaneous layer. Those who attend the workshop this afternoon, maybe we can experiment a little on this. Okay, and it's always like 22 to 25 G cannula and retrograde fanning, so I'm not going to stress that anymore. For the malar area, the zygomatic arch, the entry point can be lower for younger patients, like the line from the lateral canthal line and the alar line. But for mature patients, because she might need more lifting effects, so the entry point can be upward a bit. Okay, and you inject both the malar area and the zygomatic area, the zygoma. And the thing is, when you inject this area, don't go above the lid-chi junction. Don't go too close to the nasolabial fat pad. And you can go deep with this malar area. You can go above the bone as subcutaneous. And on the zygoma, it's more like superficial. Okay? And on the preauricular and the submalar area, the entry point can be just, actually I would say, a point that your hand feels comfortable with, and to fill the volume defects area at the subcutaneous layer. And finally, the jawline area, it's pretty much the same. And actually, the one thing is that before these treatments, we would usually plan how we are going to distribute the volume for this particular patient. Like perhaps she needs more on the temple area, or another patient needs more over here. So that treatment plan would vary from person to person. This is the summary of all the injections, and we both know that we all know that Sculptra is good for skin firming and lifting. So when you inject this area, like the temple area, what I talk to my patients is that it's not just for the contour, it's more for lifting your brows and maybe eyelids so that you can look more refreshed. And also, like, injecting this area is more for the lifting of your nasolabial fold, and injecting the preauricular and the jaw area to lift the jaw. Okay. Let's first